I'd like to invite my colleague and friend John Mead from IAVI to say something a little bit more about the coalition called CASPR. Over to you, John.
Thank you so much, and good day, good evening, good afternoon, good morning, depending on where you are joining us from. As Ethel mentioned, my name is John Mead, and I am a Senior Program Manager for Policy at IAVI. IAVI is a global nonprofit organization that works to ensure the ethical development and equitable distribution of HIV prevention tools, with the ultimate goal, excuse me, of global health equity. I want to echo Ethel's sentiments. We are pleased to welcome you to the first annual Africa Health R&D Week. This event is sponsored by the Coalition to Accelerate and Support Prevention Research, CASPR, designed by IAVI in collaboration with key partners, including IAVI, and supported by USAID, is a set of partnerships and activities focused on accelerating biomedical HIV prevention research towards the goal of HIV epidemic control. The CASPR project is focused on advocacy for biomedical HIV interventions in the pipeline from research to rollout, and brings together experienced partners committed to a collaborative movement for responsive HIV prevention research. Across the continent, health advocates and leaders have set their sights on deeper, homegrown domestic investment in health research and development, or R&D. The need for this is overwhelming. Ambassador John Nkengasong, who is the ambassador for PEPFAR, unforgettably framed this issue for the world while at the Africa CDC when talking about tools for managing disease burden in African countries. He called the lack of locally manufactured diagnostics a blight on health systems. The lack of vaccine-making capacity during COVID is the latest, most dramatic example. Outsider, donor countries, international, private, and multilateral control of R&D budgets denies Africa's national governments from having the final say-so on a host of issues. Will the African research community grow and thrive? What will the R&D agenda prioritize? What will be investigated? Who will own and develop the innovative products that come from research? And who will access the fruits of the research? In the majority of African countries, a small percentage goes to R&D. It's been clear for decades that this must change. 2023 and the years ahead offer unprecedented opportunities to close the gap. The 7th Global Fund replenishment underway now will define health spending priorities for years to come. With potent new products in the pipeline for HIV prevention, big money and big decisions are being made right now and in the months to come. A global movement to decolonize health has been picking up speed with awareness and buy-in for structural change never seen before. The impact of COVID-19 is reorganizing how societies approach health, how global health leaders are framing priorities. Pandemic preparedness is the new paradigm, and we cannot miss this window of opportunity to reimagine public health. The potential of this work can be transformative. It could decolonize the public health sector, investment in health R&D strengthening the ability of Africa's research communities to find solutions for the pressing health issues, domestic control of life-saving interventions, stronger health systems, economic growth in key areas of the economy. So today, we are coming together to lay the foundation for building a movement. Together, we can learn from each other, track innovation in funding models and persuasive campaigns, identify strategies and messages, develop a new model for accountability and sustainability, connect, continue to learn, and unite. So thank you for joining us, and enjoy today and the rest of the week's activities. Over and out. Thank you so much.
Thank you so much, John. And on to today's conversation. We have exciting conversations on the end-to-end visibility of financing for health R&D in Africa. And I have the absolute pleasure of handing you over to our moderator for today, Dr. Joyce Wamishwe. She is not only the head of division for research and innovation at the Ministry of Health in Kenya, but she's also a very ardent supporter and advocate for domestic resource mobilization for health R&D on the continent. Over to you, Joyce. If you'll unmute your video, you can let on your video and your camera as you go or take us through this conversation. Dr. Wamishwe? Great. So I believe I saw Dr. Wamishwe in the room.
Hi, Ethel. Yes, I am.
Hi. Yes, I was handing over to you to take us through this exciting conversation that we have for today. And your speakers and your panelists are all in the room.
Okay, thank you, Ethel. I thought Karanja would be the one starting. But anyway, I can do it. Yeah, I thought.
Okay.
Maybe over to Karanja. Maybe you can start as per the agenda.
Good morning, good afternoon, everybody, and thank you. Thanks, Ethel. Thank you, Dr. Mishwe, for the remembering that I'm around. So my name is Dr. Robert Karanja. I am the chair of the Coalition for Health R&D. This is a coalition that brings together over 26 organizations here in Kenya that are involved in policy advocacy for global health, also advocacy for health R&D. And we also love to be able to look beyond just mobilizing. So we are very keen on mobilizing resources, especially domestic resources for health R&D. And not looking at R&D as an end unto itself, but also understanding and doing a lot more advocacy in terms of how do we translate these R&D outputs into access to health technologies for our communities, for our people, for the societies that we serve. So CREED, or the Coalition for Health R&D, is one of the partners that has been organizing this particular session together with CASPR and also with IAVI. And so we are definitely honored and delighted to be here. And I also want to very warmly welcome everybody to this session, and looking forward to great deliberations as we consider the issues that are affecting us. Let us always remember that there's no time like the present. And I'm glad that we've already been told by John that we have all of these conversations happening across the world. The question is, what are we saying? What is the African voice saying? And how can we not just have a conversation about colonization, but also have local ownership in terms of what direction do we want to go? So thank you once again, ladies and gentlemen, and karibuni sana, as we say in Kenya.
Thank you so much, Dr. Karanja. So I think now I can actually then hand it over back to Joyce. Sorry about that.
It's okay. So let me just, so good, it's good afternoon here in Kenya, but I'm sure there are people who are seeing the morning and the others who may be seeing the evening. So greetings and thank you, Ethel, for starting us off. We are 17 minutes in, and I just want to go straight to the discussions that we have today. Today, we are going to look at end-to-end visibility, funding research for impact, and we have 5 key speakers very interesting. And at the end of this session, really, we want to understand, as we have been told, in Africa, African states really contribute very little to research and development. Actually, in one of the ECA policy briefs I was reading, it's estimated that it's about 0.6% of the GDP. The AU says we should be at about 1%. And of course, we have countries like Kenya who really push it and dream to reach 2%. Why is it so hard for African countries to invest in research and development for their populace? So we've heard about the question about we don't have locally, I mean, it's difficult to get locally manufactured, health technologies. Why is it so difficult in our region? So we will be hearing from 5 eloquent speakers, and we hope that at the end of this session, we will have gotten some answers to these questions that we keep on asking. I currently work at the Ministry of Health in the Division of Research and Innovation. And one of the things that we've been working with CREED is to really advocate for increased domestic resources for R&D in this country. So the same questions we will be trying to tackle today are the same questions we've been trying to tackle on our desks. Some we have gotten answers, some of them we are still looking for the answers. So I'll start us off with the keynote, presentation on accountability as a strategy to increase domestic resource mobilization. And this will be done by Dr. Ahmed Ouma Ogwell. We know him as Ogwell, the acting CEO of Africa CDC. So can't wait to hear this presentation. So over to you, Dr. Ogwell.
Thank you. Thank you very much, Joyce. Good morning, good afternoon, good evening, wherever it is that we are joining from. Pleasure to be here. Very important that a forum like this is being held, looking at Africa Health R&D. So it's a pleasure to be here for this inaugural session. The pandemic has taught us a lot of lessons, not just here on the continent of Africa, but indeed globally. But being taught a lesson doesn't necessarily mean that you learn the lesson. And really, the effect of a lesson well learned is usually change in the way in which we do things. So this is something that we hope as Africa CDC, institutions on the continent, globally, our member states, partners, are going to learn how to respond differently to pandemics. Now, beyond the lessons that we have learned, we also have seen that health systems have responded differently to the pandemic across the globe. Here in Africa, our numbers were low. There are people who had predicted that Africans would be dying in the streets because there is no health system, but we have a pretty robust public health system here on the continent, and it did provide some really important resistance to the pandemic. So health systems need to be addressed as a way of looking into the future when it comes to preparedness and response to any health outbreak. But beyond that, health systems are required for us to be able to be generating our own health products, for us to be able to be prioritizing those disease entities and pathogens that are important to the continent, and therefore guides the way in which we invest in healthcare in general. Research and development into all these phases is very important, and that's why this discussion today and into the next few days is so important. On the continent, we see that our out-of-pocket spending when it comes to healthcare is very high, much higher than the global average. And yet here is where income is lowest. This discordance results in Africa being left to hold the very short end of the stick when it comes to healthcare investment, to research and development into health products. Indeed, when it comes to accessing health products in general. Domestic financing continues to be an issue that is discussed a lot here on the continent and even globally, but we need traction so that all the decisions that have been made, the discussions that have been had can be translated into real action. Way back in 2001, the Abuja Declaration of 15% of budgets at national level should go to healthcare. This is still in place, not yet achieved. Very few countries have reached 15%. In 2007, we have the Africa Union commitment for at least 1% of the GDP to go into research and development. This as well has not yet been achieved. 2008, as a follow-up, there was the Bamako call to action, where countries committed that 2% of national health budgets should go to health research. Again, not yet really achieved. What's the challenge? The challenge is accountability. What is measured is done. If it is not measured, then the motivation to be able to do it is much less. So we need a robust mechanism of measuring these commitments and communicating the reality of each and every country so that we can be able to form the very important habit of making decisions and then implementing them. Many times, many governments, because of changes in administration, are not particularly prioritized when it comes to some of these commitments that were made in the past. And it is my duty and your duty to ensure that each and every new administration, whether at the national or the continental level, they appreciate decisions that have already been made and the need to implement those decisions. So these challenges in accountability are really where we need to start, because many different decisions have already been made on the continent and also globally. When we look at manufacturing specifically, we see that Africa accounts for just about 3% of the pharmaceutical manufacturing globally. Yet, we import about 70% of all the medicines that we consume. That is again skewed to us spending our money keeping jobs elsewhere rather than here on the continent. When we look at vaccines, we manufacture just about 1% of the vaccines that we consume here on the continent. We import 99%. Yet, as Africa, we consume about 25% of the global vaccines that are manufactured in the world. So this, when you manufacture only 1%, yet you consume 25% of the global vaccines, it means there's a huge space for us to be able to grow vaccines manufacturing. But you can't manufacture what you don't own. You must own, or someone has lent you their intellectual property for you to be able to manufacture. And this means that as Africa, African countries, African institutions, friends of Africa, we need to invest in research and development so that we are able to bridge that gap of only 1% of vaccines that are manufactured on the continent and only 3% of the global pharmaceutical enterprise being manufactured here on the continent. We must improve research and development on the continent. But you can't do good R&D unless you have strategic investment, unless you support institutions that do research and development, unless you support the small companies, individual experts that come up with good ideas. If we don't support them, then we will not be putting a strong basis for us to be able to do good R&D and therefore come up with products that can be able to be manufactured on the continent of Africa. We will not be able to move down that pipeline of products if we don't have good investment in R&D. The COVID-19 pandemic has also taught us that if we don't take care of our public health, then the effects are going to be felt beyond the health sector. Socially, we will have disruptions. Economically, we'll have slowdowns. Indeed, in terms of security, there will be a problem because a population that is not well controlled in terms of access to the basics that we need to live will be a very difficult population to keep safe. And in this way, the effects of not handling a health issue can immediately become not just a social and economic issue, it can also become a security issues. And that is why, as Africa, CDC, and the Africa Union, during this pandemic, we put in place mechanisms to support local enterprises, whether it was the African Vaccines Acquisition Trust, which ensured that we had access to the vaccines that are produced elsewhere, of course, onto the continent, whether it was the Africa Medical Supplies Platform, whether it is the Partnership for African Vaccines Manufacturing. We are putting in place mechanisms that will support the enterprise of research and development, because then it provides an avenue for products that are finished to be able to be manufactured on the continent and to have access to the very large African market of around 1.5 billion people. To do this, we must ensure that our researchers, our experts, our enterprises for innovation on the continent are not only provided with the support that they need to complete their innovative processes, but are also given access to manufacturing of those products at commercial level, because this is the only way that an enterprise can then be able to become profitable. And here is where the African Continental Free Trade Area treaty becomes important. The Secretariat is in place. It is doing very good work of encouraging trade within the continent. And this opens up even more space for R&D here in Africa to become a profitable enterprise. But we must do things differently if we want to have more resources going into R&D. We need to meet our commitments, those that have already been passed. If there is need to adjust as life evolves, then we need to do that. But any decision that is made needs to be implemented. That is why, as Africa CDC, we are putting in place mechanisms of measuring R&D, measuring manufacturing, measuring market access, measuring availability of resources to be able to purchase finished products that have been manufactured here on the continent. If you measure it, then it is going to be done. If you don't measure it, then it is not going to be done. And the only way to ensure accountability is to measure and communicate with respect to the various policy organs on the continent, to the partners on the continent, to our member states on the continent, so that they know what the reality is. And then we propose ways forward in terms of getting ourselves from a lower level to a higher level of R&D and local manufacturing, particularly for health products. To do this, as I conclude, we need to set our own research agenda. Which are those items that we need to do research on? Which are those disease conditions that we need to be focusing on when it comes to R&D? Which are those new platforms that we can be able to come up with for diagnostics, for therapeutics, for vaccines, for countermeasures? Which are those partners that we can be able to work with? Setting our own research agenda is the first place. In the first place is a very, very important step. Second is governments need to meet their commitments, whether it is 15% to the health sector, whether it is 2% for research from the health budget, whether it is 1% of GDP into research and development. We need to meet those commitments. And we are working with our member states to show them that investing in research and development is actually way, way more important than looking for the lowest price in the open market. And to this end, I would like to conclude with two messages. One is those of us who have access to information, how important R&D is, how important domestic resourcing for R&D is. We must continue to engage with our policymakers and let them know what the reality is. If we keep quiet and complain amongst ourselves, it means someone else is going to be advising our policymakers. So we who know, we must go out there and engage with our policymakers with good evidence and let them know the importance of meeting our commitments to those policies that have already been passed, and also investing in research and development here on the continent of Africa. Second is, let us ensure that whatever is researched on, whatever is developed, is taken through to be an actual product that is going to help the continent based on our priorities. Let us research African priorities. Let us develop products for African priorities. Let us manufacture all these here on the continent of Africa. And in terms of accountability, we must document every step very well. We must ensure that we have information about what we are researching on, what we are developing, what we are producing, and how we are purchasing it. And finally, all these must also be communicated to our partners, so that when they come to support African enterprise in whichever area, they're supporting a priority of Africa. And this is today my message to you. And I thank you very much for the opportunity to speak with you during this inaugural meeting. Thank you.
Wow, that is fantastic. Thank you so much, Dr. Ogwell. Fantastic listening to you. As an African, I am so proud that you're seated in that seat, and you have said it. For Africa, by Africans. And there's one thing you have that I loved what you said. We have kept on saying the cliche that the pandemic has taught us a lot of lessons, but have we learned? And the only way we can tell that we have learned is if we change the way we are doing things. So fantastic take-home messages, and they have hit home the to measure. You actually answered the question why the biggest challenge in domestic financing is about accountability. In my capacity, I've always wondered when the reports about what African states have contributed to R&D, when those reports come out, where do people actually look? Because I am yet to see a template or something that is visible to even people at my level, at the technical level, that tells us this is how much has come in for R&D from the domestic resources, from the international, from our partners, and this is what it has been used for. The other question we keep on asking ourselves is, why is it when we attend local conferences like the Cambridge Annual Scientific Conference, and there are scientists there who have done a pretty good job, including squeezing various leaves and coming up with something that is said to treat an ailment that affects us. But after that, you never get to hear of that moving towards the market. And you have really talked about that and brought it out very well. So thank you. And we now move to the second presenter. And he is from Rwanda, the Ministry of Health Rwanda. He's called Dr. Parfait Uwaliraye. I hope I have mentioned that well. To hear about Rwanda's experience in tracking health research funding sources, we always hear that whatever we are unable to do in Kenya, for example, Rwanda has managed. So I can't wait to hear, how have you guys been tracking the health research funding resources? Over to you.
Thank you very much, Dr. Joyce. Can you hear me?
Yes, I can.
Okay.
Perfectly
Okay.
well. Yes. Thank you.
Thank you so much. Thank you so much for inviting us, the Ministry of Health. And of course, this important conversation about how can we track research funding, but in the overall topic about how can we ensure that there is appropriate funding for health research in the African continent. First of all, I would like to thank what the previous moderator, what has been highlighted in terms of how can we build our own research agenda, but also identify what are the potentials of domestic funding. We can support the implementation of a research agenda as African. But more specifically, what you mentioned, it's about research agenda responding to the needs of our population, responding to the critical issue that we have in our health system. So going straight to the point about sharing the experience of tracking the health research funding sources in Rwanda. So as the importance of this activities there, it's about how can we have data on our hands and always helping us to monitor our research agenda. So we have been able to put together some of the data system, the national data system. There is one, of course, the overall the overall system that capture the health resource across various sectors, including also research as one of the key subdomain under the knowledge and management. And that's being done on a regular basis. We collect different data from partners, all partners, private sector, academia, CSOs, governments, so we can make sure that we can track all activity and make sure that we have all the picture around every subdomain, including the research. That's being done on an annual basis. And we capture both the expenditure and the budget. Expenditure for the past year, also the budget going forward. But for the purpose of having a comprehensive way of capturing of the data, we all know research is being conducted as we move around, we move forward. So there is a lot of research being conducted in the health sector. We have institutionalized a way of tracking those research that are being done, that are being conducted on a regular basis, so that we can ensure that we can monitor the trends and make sure that there's still that alignment with the country priority in terms of research and the development. So at the Ministry of Health, we have a subcommittee, what's called National Health Research Committee, where every stakeholder or every person that wants to conduct research in Rwanda, especially in the health sector, has passed through before even get to the ethics committee. So that committee is under the Ministry of Health, of course, in our Department of Planning and Health Financing. So one of the requirements that they report, so when they submit even the proposal, they also there is a component of the budget where we capture budget. The budget that's going to be used to that specific research. So we have constituted that kind of database that we run on a yearly basis, and from that database we can run different analysis to see what are the priority areas that are being financed, or what diseases, where it's being done, which part of the country where the research is being done, who is the research implementing agency. So we can have those kind of the data. So we triangulate those information with the yearly what we capture on a yearly basis, the overall resource tracking system, so we can make sure that the kind of alignment. So we capture all the data that are going to the research and development, and from the analysis we will be able to have what have been injected in the research or have been used for the research. But this is not being done only by the Ministry of Health. Of course, we do that at the Ministry of Health, but we keep sharing with the researcher community, the implementers community, the one who are implementing research, to ensure that they're not only reporting and it's not like it's as if it's a requirement, but we keep engaging them to ensure that it's quite good ownership and they understand the purpose of reporting those kind of data and the importance of alignment with our country priority in terms of research agenda, but more specifically, as rightly mentioned by Dr. Ahmed, the CEO of African CDC previously in his very insightful remarks, the accountability purposes. So to ensure that we keep accountable, all of us are accountable to each other, that's kind of spirit to ensure that we are moving in the right space and we keep aligning ourselves in terms of priorities of the country. So this has been there for the past 5 years. That's why we're doing it. So it has also helped us to build our systems, but also running easily in terms of when we conduct situation analysis, when we want to review any document or research agenda that we are going to review very soon, but also getting any other initiative or reform in the health sector in terms of incentivizing people to do research, but at the same time capturing what research is entailed in terms of funding, but also the evidence that has been generated from the research to ensure that it contributes to the policy formulation, but also to the country priority. So these are the few highlights I wanted to share with you what we do here in Rwanda. So thank you so much for the opportunity to welcome any discussions for the panel. Thank you so much for inviting us. Thanks.
Oh, thank you, Dr. Parfait. I think you were the right person to follow Dr. Ogwell's presentation. You have ably demonstrated some of the things he was bringing out, that yes, you are able to measure, you are documenting what is happening in the country. I think one of the things that is stood out was that you have the National Health Research Committee, and it is the first go-to place, even before somebody begins to seek ethical clearance for their research work. I think that's something that Kenya has really picked and will definitely be looking into. But the other thing you also said is the communication bit with your partners and having them understand that there's need to report into to report the work that they're doing for ownership, but also for accountability. So really great take-home messages there, and also a great echo to what Dr. Ogwell talked about. So now we'll open a moderated panel discussion, and in addition to our two eloquent speakers, we are now going to invite 3 other speakers, and you'll allow me to introduce them so that we can then now move to this second session. So we have Professor George Setswe, who is the Managing Director for the Implementation Research Division at the Aurum Institute in South Africa. And then we also have Professor Christian Happy, Professor of Molecular Biology and Genomics, Redeemers University in Nigeria. And lastly, we have Dr. Evelyn Gitau from APHRC. She is the Director of Research Capacity Strengthening. So I'll allow each of our additional 3 presenters at least 2 minutes to briefly share on practical experiences on what's happening in R&D before we get to specific questions that we'll continue to unpack and most likely still echo what our 2 initial presenters have brought out. So over to you, Professor Setswe. 2 minutes, just give us a bit of what you're doing at Aurum Institute, and then we can take it off from there. Over. Bye.
Thank you, Program Director, and thank you for inviting me to this important meeting. I work at the Aurum Institute, and I also work with the SATAC, and I want to just, for my 2 minutes, share one slide that shows what is going on global funding for diseases for research. And these are diseases that I am personally involved in. And this slide shows that the key, let's say 5 or 6 diseases that were involved in Africa. It shows the mortality and also shows the funding. And it is quite clear that COVID-19 gets the share, $9 billion US funding out of the 3.3 million people who die from COVID. This is followed by HIV/AIDS with 1.3 billion US dollars, and the third on the list is tuberculosis. And if you look at the number of mortalities from tuberculosis is 1.5 million, and malaria is number 4 on the list with 619 million. And I think this slide was prepared by colleagues in the malaria research area, because they were asking the question, has the world forgotten about malaria? And the points I want to make around this slide is that as a continent, COVID-19 did not hit us hard, as you may have heard about from Dr. Ogwell, that the people in the West allocated funding, and it is quite clear that there is funding for health R&D, but it is inequitably distributed. With regard to HIV/AIDS, there was dipping, and TB and malaria. There was dipping in funding between 2019 and 2020 and 2021 because most of the funding was going out to COVID-19. And what we're not sure of is whether we're going to have to resuscitate, the momentum that we had created for dealing with HIV/AIDS, TB, and malaria in our continent. I think I should just stop there. Thank you.
Thank you, Professor Setswe. Well put, and we will get to certain questions regarding funding once we move to the next session. But for now, Professor Happy, over to you.
Oh, sorry. Thank you. Thank you, and then thank everyone for the opportunity to be here. I think Ogwell has really spoken well, and I think as a leader of the Africa CDC, he's really spoke the mind of the continent. He understands, he interacts with the leadership of the continent. He knows exactly what he's talking about. I think I basically just have to say in my own setup, we've been working in the space of infectious disease right from the beginning. We've been very innovative at the African Center of Excellence for Genomics of Infectious Disease. I probably just want to share a few things with you to let you know how innovation can happen in Africa, but at the same time, how Africa neglects its innovation and rather prefer to buy outside. And Ogwell has made it very clear, if we were investing where our mouth is, I'm sure we would have done things very differently. Even though the Africa CDC has really taken over, by adopting what I'm going to talk about, which is genomics through the PGI, and then has really helped the continent to respond to this COVID-19 epidemic or pandemic in Africa. I just wanted to share a few slides with you to let you see how important and how innovative Africa could be, but at the same time, how innovation can be ignored on the African continent. And I will take you back here. Let me just share my screen briefly for you to probably see what I'm talking about. Sorry, I just need to, where am I now? Okay, let me get back here, share briefly my screen, and bring you over here. This is 2014 during the Ebola outbreak. we gathered and we understood in West Africa, that's the largest outbreak. We understood that this virus could spread outside the Guinea and could actually create havoc. We went on to design assays to detect molecular assays to detect the virus. And in addition to that, we set up a platform for genomic epidemiology at the time. And within the first 3 weeks of the outbreak in Sierra Leone, we sequenced the first 99 virus of Ebola and made it openly accessible. We shared the genome data with the global public health community. At that time, WHO was 50 years behind in terms of knowledge. They were saying at the time that we were doing research, but we were telling them that we were doing this to guide public health response. We generated data within 10 days of genome sequence data within 10 days and shared it publicly. What is important is the fact that you could see here how early in 2014 we started identifying different variants responsible for outbreak and controlling and spreading the epidemic. Here, by June 16, for instance, we could show how one variant in Sierra Leone, we have 2 different variants of the Ebola virus, took over and became the variant that was dominating. Why was that dominating? We're the first group again to demonstrate that they were dominating because of mutations that were associated, were accumulating within the virus genome. And those viruses were associated with increased transmissibility. We went on, to use such data to demonstrate, as you see here on this diagram in space and time, how you could use genome data to show transmission chain from house to house or block to blocks, from county to counties, from district to district, region to region, country to countries. These were innovation done in the 2014 Ebola outbreak in West Africa. We went further to actually go to use the genome sequence data to develop the very first Ebola rapid diagnostic test that was approved by the WHO and the US FDA under emergency use authorization. The question, I will stop here. Did Africa at the time took this up, harnessed it, and became the owner of these platforms? The answer is no. What the platform, the technologies that you use today, that we use today to respond to COVID, were born in Africa. GISET, when you hear about GISET and then data sharing, putting things in GISET, we pioneered that. When you hear about identifying variants of concern and variants of interest, we pioneered that through the data that I showed you. When you hear about developing rapid diagnostic tests for infectious disease, we pioneered that. When you hear about using genomic epidemiology for public health response, we pioneered that. Are we the owners of the technologies today? The answer is no. What did we do to take up this technology, harness it, and then lead the world? We failed to do. I will stop here. And then just to continue to say, we apply these technologies to other epidemics in West Africa. During the COVID-19 outbreak, we generated the very first genome sequence on the African continent within 48 hours of receiving the samples in Nigeria. It wasn't because Nigeria was the first country to report COVID. It wasn't because Nigeria was the second country. Nigeria was third. But because we had the knowledge, the skill, and the technology in my center, we were able to generate that first genome. And that created the impetus and the confidence of to Africans that they could do this. And they went on, as you could see, through South Africa, identifying the beta variant, identifying the Omicron and everything. That's exactly what Africa could do. But do we really, are we harnessing this and leading the world? The answer is no. I always say one thing. Africa has a unique opportunity. And that unique opportunity is the fact that, we are not only rich in human resources, natural resources, or mineral resources, we're also rich with very powerful biodiversity. And as part of that biodiversity in Africa are these microbes. We should be able to harness that biodiversity and teach the world how to do things, creating diagnostics, creating therapeutics, creating vaccines. Are we doing it? No. The answer goes back to what Dr. Ogwell mentioned. Are we investing in R&D? The answer is no. Are we putting the resources where we're supposed to put it? The answer is no. Is that a priority for the continent? The answer is no. Our leadership should understand that we have to invest where our map is, because the future of Africa is intricately related to R&D, and especially on these infectious diseases are non-communicable diseases. Thank you.
Wow. This is the place where I ask all of us to, unmute and breathe in and out a sigh, because well put. Is Africa suffering imposter syndrome? That is what I'm wondering after what you have just presented, Professor Happy. What a nice way to start this panel discussion. So the question, and it's one of the questions that we had put in our discussion, is then if we all know all this and we know what needs to be done, then why isn't it getting done? What does it take for our leadership to understand and feel that they must and should invest in research and development? I'm reminded of a scenario when, as Kenya, we've just finished doing the report on our 7th Kenya Demographic Health Survey. So this is a survey. We all know that surveys come, periodically. So we all knew that this KDHS would come up, but you find that even asking for this to be put in the budget estimates is a struggle. So we have come back, we keep on coming back to the table and asking, so what do we have to do to make them realize that they need to invest in things like even Kenya Demographic Health Service, let alone, the experimental research, but just even survey work. So it would be interesting to hear reflections on what must we do, because we already have advocacy. We already have the documents that tell us this is what must be done. We have excellent scientists in this part of our region, the Professor Happy's, the Professor Setswes. What is it that we are missing? What is it that our African leaders, our policymakers are missing, so that they can then feel the urge to put the money in research and development? So I'll start with Dr. Parfait. Over. Dr. Parfait?
Yes.
Yes. So your reflections.
Yes.
Yes. Thank you.
So I had a problem with the connection a bit. I didn't capture very well the last part of the question.
Okay, just for your sake, what I was asking, what is it that we need to do more so that our leadership feels the urge to invest in R&D? What is this rate limiting step that we must cover so that we put the money where our mouths are? Over.
So thank you very much, Joyce, for the question. Just quite the way of transparency of the way of capturing our data. So we are asking funding or money for research, and yet we don't even show up, showing the where the money goes for the research. So we need to first of all build a very good information system to track what is being done throughout the research implementation. This means involvement of each stakeholders, understanding, very good understanding from all stakeholders, understand the importance of building that kind of information system. Then we'll be able to show, to convince the leadership that the money that we are going to invest in the research and development is going to respond to the needs that we have. So it's what's missing most of the time is that articulation between what are the country strategies and policies, and what is the contribution of the research or the evidence that we mean to be the evidence be generated by the research. So we need to get very good information that are reliable, but also that can trigger sound decision from the side of decision maker. So we show them this is the gaps that we have, and of course the reason why we are advocating for this kind of funding, it's because the priorities that we are trying to respond are completely aligned with the priority that are in our country strategies. So we need to build a case, and building a case requires evidence. It requires capacity from the people who are going to defend that. It is require also the good understanding from all stakeholders, so that you ensure that there is a good way of advocating, or a good way of presenting our case when it comes to convince the leadership to invest more money for R&D. So that's quite what I can share about that question. Over. Thank you.
Thank you, Daktari. Professor Setswe, your reflections on that particular question. Over. Professor Setswe, your reflections. Okay. Professor Happy, I know it was after your presentation, after your I am still stuck at what you said, but perhaps you could add some more. What do you think? What do you think we need to do?
The issue is multidimensional. I do want to agree with my friend Parfait that while we have to present to government, we need to prevent facts and everything. But I don't think that that's where the issue is. Even when you present the facts, even when you present everything to government, is always a matter of priority. It is a priority. It's for me, it's whether it's a fruit of colonization or what, I don't understand. Africa tend not to believe in themselves. They don't believe that they can do things. They don't even believe, because they've been told times without number that they are useless. So they've come, our leadership has even come to accept that fact. And I think we need to go beyond, we need to really get off that kind of mindset and believe that we can do things. Prepare anything, as you mentioned, in Kenya, you have, in Cameroon, you present product. You want to tell me that when Cameroon has his scientific week, as you mentioned, madam, that people from the Ministry of Health don't go there and see those things? They see those things. The question is, can they take it beyond, or people in Ministry of Science and Technology, they see those. The question is, do they believe that that can go beyond the extract that was presented to them, and then can they put the resources? They would rather leave that and then go and buy from China, or go and buy from outside, go and buy from all of this. That's also a fact. But we need to learn how to go beyond it and start believing in ourselves. I think it's, first of all, reinventing oneself and rethink about this continent, whether it belongs to us or it belongs to people outside. Because we've been told maybe times without number that this continent do not belong to us, that we need to be referencing ourselves to other people. Why do we need a reference? There are just too many things, and then those are the limitations. If you're creating a diagnostics in Africa, where is a yardstick? Today, the Africa CDC is trying to change that through the AFTA and everything, but you will have to get approval. Remember, I mentioned diagnostics. For me to use it in Africa, I needed to get approval from WHO, and then the US FDA. Can we set an Africa yardstick to solve African problem and then, use that as a way to address local problem? I think once we start thinking, let's think about how we do things ourselves, how we set our own agenda without having been told by others. And I think with that, we will move forward. And I can give you a few examples how, when you think Africa and breathe Africa and believe Africa, you can save situation. In 2014, when Nigeria, a country of 230 million people, had its first case of Ebola outbreak. It happened in Lagos, a city of 23 million people at the time. What happened? The government, knowing fully well our capacity, sent the sample to my lab, and within 6 hours, we were able to say that it is Ebola, and then in the next 48 hours, we sequenced, and we knew that it was a Zaire strain. That information was shared immediately with government, and we set up a mechanism to contain that outbreak, working in very close collaboration, making it happen. Nigeria ended that, that epidemic in 93 days with only 20 cases and 8 deaths. And this happened because we had in place at the time a minister of health that believed strongly in what we were doing. When he was being told by the WHO and ordered the CDC, the US CDC, I said that no, the sample had to be sent outside the country to confirm. He said, I believe in this lab and we're taking action on the data that were coming from out of this country. But I can tell you that if this sample were being sent outside for confirmation, by the time the result would have come, the epidemic would have gone like a tidal wave in the country. So I think we need to really rethink and change our mind and prioritize Africa with Africa for Africa, and we can move things forward. Thank you.
Thank you, Professor Happy, for that. Well put. One of the things that came out was in your conversation was that the leadership actually believed in its people, in that last example that you've given, and in the capacity. Now, we started this session with Dr. Ogwell saying that COVID made Africa realize that we were on our own. We say we learned the lessons, but have we changed? So one of the things we have begun to see in our country, like for example, in Kenya, we now are beginning to see the push towards local manufacturing. But I've also heard the cliche of when you manufacture in Africa, it's more expensive than because of, I don't know, we have so many taxes. So at the end of the day, people still look towards getting whatever health technologies from outside and bringing them into Africa. What's your take on that? Let's talk manufacturing. Let's talk local capacity. Dr. Ogwell, perhaps you can unpack that a bit more. Over. Dr. Ogwell, your reflections on that? Okay. Professor Setswe, I understand that Dr. Gitau is not with us. She gave her apologies. That is why you're not hearing me mentioning her. Professor Setswe, any reflections? Okay. So let me try and put it in how we want to tackle this. So in terms of one of the questions we had that's related to the manufacturing bit is, what should Africa states do to move from consumptive research to productive research? Because that is what we've been talking about. We are more used to consumptive research, but we don't have our eyes on productive research, and Professor Happy really gave examples of a lot of work they have done, but at the end of the day, the patents don't belong to us as Africa. They belong out there. So what should we do beyond the leadership believing in the capacity of its people? Is there anything else that we should do? And maybe I can, Dr. Parfait, want to handle that? Am I audible?
Yes. Yeah.
Yeah, I'm just
Yeah.
trying to follow up on the conversation. I know we had some leading questions, but I'm picking the leading questions and following up on the conversations. So how do we move to productive research? Which is really, manufacturing is one of those things. Yeah. Your reflections on that. Over.
Thank you so much, Joyce. Moving from implementation research to productive research require a lot of investment, not only the funding that goes to implementation, but also there's a need of huge investment in terms of infrastructure, capacity, but also institutional strengthening. So for infrastructure, you have to have good infrastructure in place that are conducive for the research, but also that can serve for the purpose for any productive research you need to conduct, either getting up to the manufacturing or any other thing that you want to do in terms of development, moving from research to development. That infrastructure, most of the time, it has to be provided by the government because not only for the private sector, the private can come in, but first of all, it's meant as the mandate of the government. And so the government can also choose if they want to partner with any partners, but have kind of solid agreement or arrangement in terms of implementation, because some of the time when it comes to research, you find some countries where research institutions are bigger than other national institutions, so they can also not be able to comply with the requirements and become another sort of policy entity somehow, trying to dictate evidence or bring evidence. But when the government takes the driving seats, it drive all the initiatives and put together, have that responsibility of building responsibility, building the capacity, make institution working. I mean, for example, regulatory agencies are put in place, but also working very well because they have capacity, but also they have tools to implement the regulation as it's required by the international standards. That's the part of the government. But there is a way government can partner with the private sector, can partner with local non-government institution in terms of capacity building, also the infrastructure. But what's important is to have the government driving all those initiatives rather than leaving to the partners, either privates or local non-government or non-international government organization to lead the process, to avoid that the research or the product of the research or the production that will come from the research not be owned by the government, or it's harmful for that specific institutions. So that's why sometimes we found that research are being conducted. Maybe we found that, like I give an example, when discussing some other colleague from the government for other countries, also like this, we have a lot of research conducted in our country, but yet they're not even contributing to our policy formulations, or they're not even responding to our needs. It's because the kind of that gaps that has introduced when the responsibility somehow has been outsourced to someone else. So which is very, 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 we need to avoid it, the government. We need to take the ownership, also build that kind of driving, that sits and driving all the initiative around the research up to the development. Because development serve for the goods of the population. If the vaccines, it serve for the population of goods. It's not serving for private sector. Because if the private sector owned, that will not be able to people to purchase or also access those kind of services, either vaccine or devices or any other medical products. So we need to have the government on the driving seat. Thank you so much.
Thank you. So have the government on the driving seat. Now, one of the things, if we can recall, as we were tackling the COVID pandemic, one of the things we noted in our country was that at some point, each subnational unit wanted to have an oxygen manufacturing plant. You know, within the country, we have what we call counties. So you can imagine 47 counties, 47 oxygen manufacturing plants. Dr. Ogwell, perhaps you can respond when you talk about what you see regarding productive research for Africa. Is there the dream of having, you know, regional alliances and perhaps saying a certain number of countries to come together and do this particular thing, maybe manufacturing of vaccines, and then the rest of Africa should be able to buy from them? Or how is this thinking about local manufacturing from an Africa CDC point of view? Or do we expect that each country will have their own biovacs, for instance? How do you see this from an Africa CDC point of view, from a strategic point of view? Over. Dr. Ogwell.
Sorry, Dr. Mishwe, I think Dr. Ogwell might have stepped away from his
desk.
From his desk temporarily, and will be notified when he's back. He had an emergency to attend to.
Okay.
So that probably then will go to the other.
You can help me to, I don't know, is Professor Setswe with us? I can't also seem to see him.
Oh, I'm back. Apologies.
Oh,
I had load shedding problems.
Okay. So did you hear what I said, or do you want to?
No, I just joined back.
Okay, fine. So maybe we can have Professor Happy responding to that, reflecting on that bit of how should we go about it as Africa? Should we each one of us have our own biovaccines, or should there be like some form of regional alliances, or what is the thinking currently? Over.
Yeah, I think I will first of all try to address the previous question that Dr. Parfait addressed, and pivot to this one because they are all interlinked. Yes, I do agree that the government should provide a framework for the policies, and then maybe the regulator should be the regulatory authority. But to put the government as the driver for every research and development on the country is a danger, and that's why we are where we are now. What governments in Africa should do will be to create a framework and actually create an incentive for people that want to do development. That is basically translational research to create product, to create, an incentive that is basically for startups. You're talking about tax waivers and all of those things in order for people to take this, the research to a point where they can develop, countermeasures. That's why you mentioned the fact that things are expensive. Of course, if you want to do manufacture within the continent, you are still going to pay tax to government at the beginning. Then you can't compete with the price. And that's what happened all over the world. We need to encourage, local manufacturing. The private sector should invest into this, and then you should create like tax breaks and encourage, invest into startups. And then they will walk along the lines and the priorities of government to develop countermeasures. But to say government will be at the center of everything, it will never work anywhere. That's exactly where we are today. When you look at the vaccine manufacturing in the US, for instance, for COVID, of course, the US government put a lot of money, but who did the manufacturing? In the private sector. So you need the private sector, you need the private farmers, you need private entities to work with in order to address national problem. But having the government to be responsible for everything, I don't think that is a solution. We need to start thinking about having government working with the private sector, working with researchers that want to translate this thing to address problems. That is one thing. Now, getting down to the fact that for the biovax and then how we need to have, everybody wants to have a biovax, I don't think is sustainable. I think what we need to do is rather to think about identifying hubs of excellence where we can have those productions, where we can actually bring people together to produce the vaccines and eventually, distribute from those hubs across the continent. But before then, the mindset of our leadership and the continent should change. Few countries are doing it. I ask if in Africa you cannot move banana from country A to country B because of all of these borders that we've inherited from our colonial masters and actually made it even much more harder than the colonialists themselves. How do you move a vaccine from country A to country B if you cannot move banana? So that is the fact. Moving knowledge, and it's going to be very difficult to implement these things in Africa because you need concentration of knowledge in one place to work. To produce a vaccine, you can't have all of the expertise in Kenya or in Rwanda or in South Africa. You need a concentration of people with different skills to come to place to work. But how do you get that in a continent whereby for someone to move from Nigeria to Kenya is more difficult than to move from Nigeria to the US or to Nigeria to any other place because obtaining a visa from country A to country B? I think we need to break all those silos. You can't function in an environment where people are evolving in silos. You can't function in an environment where countries are so protective of what I don't understand, and you expect the continent to develop. There's no brain circulation. There's no knowledge circulation on the continent. And studies have really demonstrated that there is a clear association between brain circulation, knowledge circulation, and R&D. So there is a need to create hubs, but Africa needs to depart from the silo that it has put itself or they've created, the barriers that they've created around themselves, in order to enable this to take off. Thank you.
Thank you.
Can I come in, Program Director, just to make a point about the public-private partnerships that the private sector is playing, it's not coming to the party with regard to support for health R&D. And we have billionaires in the African continent. Where are they? Where is their money going to? How do we engage them in this conversation? How do we create public-private partnerships? The public sector, and Dr. Happy is right, that we can challenge the governments to do their part, and we're asking for 1 or 2% from them. We're not getting it, but the private sector can come in, and we can see that the billionaires and the other private sectors who are making money. At a time when we have challenges like COVID-19 and tuberculosis and HIV, AIDS, and malaria, we cannot have the money going elsewhere, and we are not saving the lives of Africans. So public partnerships should emerge that are focusing on specific projects and that are successful. Thanks.
Okay, thank you, Professor Setswe. Thank you, Professor Happy. Well said, well said. Brain circulation, knowledge circulation, is related to R&D. The need to have hubs of excellence. Where are the billionaires? Where are the African billionaires? We are so used to Bill and Melinda Gates. Where are our Bill and Melinda Gates? And then the whole issue of Africa needs to believe in itself. We seem to be having serious imposter syndrome. Could be because of the colonization aspect, but it's about time that Africa believed in itself. So well put. I can see in terms of our time, we are now at 3:30. And before I allow 1 or 2 questions from the participants, the last bit that we want to talk about is on the sorry, just give me 1 minute. On the whole issue of, we've talked about incentivizing, we've talked about transparency that has been really brought out well by Dr. Parfait. We've really talked about the lessons that we have learned. I think the bottom line is we need to move from saying that we learned a lot of lessons through COVID-19, but more rather now begin to talk about what has changed given the lessons that we learned. We have also talked about what we need to do to move from consumptive research to productive research. And now the last bit that we want to tackle is, what is the role of research institutions in advocating for increased investments by governments? What should the CEMRIs of our countries be doing to advocate for increased investments by governments? One of the things we are trying to do in Kenya is, yes, at the end of the day, there is some money that comes from the exchequer and goes to our premier research institution. We are now we are working on documenting to show the lawmakers that you gave us this money and this is what this money has done. Had you given us X amount of more money, this is where we would have reached in our journey towards the market. That is something that we are working with our research institutions on doing. So it would be nice to hear practically what is happening in your countries. Is there a role for research institutions? And we will start with Professor Setswe. Over.
Thanks. There are 26 institutions of higher learning in South Africa. 9 of them are medical schools. And one of the things that that we're doing is we have realized that the government alone cannot be able to provide funding and resources for health research. And so we are strengthening our capacities to access funding for health research through partnerships. So we are partnering with the NGOs are partnering with universities, and there's also partnership with some private institutions where we access funding for health research, and we conduct evidence-based research, and we're able to provide evidence to change policies and programs. But we're also lobbying for more South-to-South partnerships, because while we were chasing up money from the West, we ended up forgetting about our colleagues in the African continent. So there are partnerships between Southern African universities with universities in Ghana, the universities in East Africa, to ensure that we focus on the priorities in our, and this is also a way of owning up to our research agendas. And lastly, I just want to say that in expanding the vaccine manufacturing capacity on the continent, you may have noticed with the COVID-19 vaccine manufacturing in South Africa that there was involvement of colleagues from the rest of the continent. So there is a necessity, as we expand vaccine manufacturing capacity, to also build health research capacity in clinical research, in biomedical research, and in translational research, because a lot of our top scientists find it easy to relocate to other countries, and therefore where we have very strong partnerships, we're able to keep them, we're able to complete projects that we have started. Thanks.
Okay, thank you, Prof. Prof. Happy?
Yes, I think the question was, what do we do in order to accelerate and then ensure that government provide more resources in order to be translational? You mentioned it, there's need for transparency. We need to justify the resources that we get from government. We also need to be productive so that government can see that the little resources they are putting lead to things, and then they can put more. But I also think that it's very important for government, when they are budgeting and planning, to call the people, to whom the money will go, so that they can have an input. You can't be sitting in a research institute and then a budget is done at the ministry, and then you're being told that this is what you need to do your work. No, I think there's a need really to get those people involved in budgeting in order to say, okay, this is, and then ask government, what are your priorities? And then they can work along those priorities and budget. But once the resources are released, no matter how small they are, we need to be accountable. We need to make sure that government actually sees value for the money that they are putting, no matter how small that is.
Thank you. Thank you, Dr. Happy. Dr. Parfait, what is happening in Rwanda what are research institutions doing to convince government to put in money? Over.
Thank you very much. In Rwanda, it's quite very somehow different because we work together. So one of the research institutions, they are part of the process that we engage. We support them through different initiatives when it comes to there's funding that comes from the government, either through competition, grant competition, or also support them in terms of when they go to do application for the grants. But also we agree on the specific action plan. That's how the grant is going to be used, especially for specific research. So the government provides the various incentives from that part of from the engagement. First of all, when we engage the government, we try to sit and understand what's entail of the projects. We support them in terms of accessing some funding when it's available from the side of the government. We have a national, the government provide money funding through the National Council of Science Technology, where different people can access, apply for grants. But we help them, even the researcher, to formulate better their research question so that they'll be able to prepare good and sound research for also the kind of funding, because we want them to respond to our needs. So we don't want them just to coming from, sitting alone and developing a kind of proposal for funding, and yet they know it's not responding to our needs. That's why we engage them from the beginning. We also help them to try to identify, when they do grant applications for different funding, we give them support letter as a government. We also help them to give them make them their grant more sound, also solid or robust to when they're going to apply. And another thing that makes we work with this research institution, it's about when the research comes out, it shouldn't be left in the shelves. We ensure that when the research is out, they bring to the Ministry of Health, and we try to go through and understand what are the policy implications so that we can go together. Once we understand and also go through the research findings, the policy implication, the government through the Ministry of Health own directly or immediately that's kind of research. And we are the one organizing the dissemination of the research institution to ensure that the proper ownership of the findings, because we are the one who are going to influence the policy formulation or the implementing or the policy initiative that are come from the evidence. We are also the one bringing other stakeholders on board when it comes to the dissemination of the research. So our motto is that no research invested in the people of Rwanda should end up in the shelves. It should come to the table of policymakers for discussion. And from the discussion, we ensure that it's going to contribute to the issue that we have as the health system, as the health sector, the country in general. Those are the things that the way we work with them. So we shouldn't be like, I'm independent, the way of research, sometimes they behave. I'm independent. You are the government, I want to show. No, it's not about being independent. It's not about being controlling. So government not controlling. It's about how can we, both of us, work together for the common sake of the people of our country and ensure that the research comes to address the issue that we have on ground, not for the sake of contributing to your fame or your making big your CV. Thanks so much.
Yes, Dr. Parfait, that's one of the things we keep fighting with the researchers in our country. They want to stop at publications. But now, of course, in the last few years, the whole bit about knowledge translation has really been strong. And we are hoping that there is immense culture change for people to move that direction. But going back to what Professor Happy said, it all starts with the leadership having a different mindset. So we are at 3:37, having about maybe 23 minutes to the time we should end this. I think we have some time, a few minutes to get maybe 1 or 2 questions from the participants or reflections. And then once we are done with this and we have responded, I will allow each of the speakers 2 minutes to give closing remarks. And then we will do a summary and then call it a day regarding this session. I hope that is okay. So James Kamau, I've seen your hand has been up for quite a while. Maybe you can say what you wanted to say now. Over. James Kamau. Ethel?
Yeah, it looks like his audio is not functioning. But there is a question that James had raised, and he had specifically targeted it to Prof. Happy. And he was looking at what were the cost savings that the innovation at the height of the Ebola, the Ebola crisis, what cost savings did Nigeria have by that, the gene, by having invested in the first gene expert for Ebola? What can you say was the cost benefit? Prof. Happy?
Well,
Okay.
the direct cost benefit is actually the number of lives saved. I'm very sure that if the virus spread in Nigeria, it would have actually created havoc, not only in Nigeria, but at least in Africa. Because Nigeria actually is the largest, if you look at the airport, is the biggest, travel hub in Africa. And then the same for the port. So the consequences would have been disastrous, not only for Nigeria, but for Africa. So I think, and you can quantify that. That is just a fact in terms of human lives. And also in terms of financial, benefit. I'm not a health economist, but I definitely know that clearly, the country saved a lot. I mean, if you have a country of 230 million people with an Ebola outbreak and you end up only with 20 cases, and then 8 dying, then you can imagine how much you save. Smaller countries actually had, more to deal with. So, and as such, it would have been exponential if you had the outbreak spreading in the country. That's pretty much what I can say.
Thank you very much. This is James Kamau. I love what you have answered. And you have actually answered the whole question. You did not get the expertise of the health economists to bring out the value and issue. Why am I saying this? We had a lot of benefits, but until we quantify this in terms of money and the cost benefit of the gene expert that you did to be able to save lives, then it will be very difficult to ask the policyholders to invest. So I think one of the issues that needs to come out is from each innovation, there needs to go in line with the cost benefit so that we can go further. And that brings me to also the point which Dr. Sene put when he said we need to get local investors to be able to fund the R&D. I come from Kenya. We have a mobile company called Safaricom, which is together with Vodafone. I'm sure you have it. They make huge, they're the largest company in terms of profits in the whole of Eastern Africa region, but they have not put one single shilling into health and more so R&D. So the point I'm trying to say is that until we can comfortably and easily put the cost benefits of R&D, or why lack of R&D, the amount it will cost, it will still be very difficult to get local funders from the country itself. And thirdly, I think we also need to learn from diseases. HIV, TB, and malaria is largely funded through Global Fund and PEPFAR, not the countries. In fact, the only people who learned their lessons is South Africa, because they are a high middle income country, and the Global Fund and PEPFAR didn't. And I think this is something that needs to come out. Thank you.
Yeah, I can basically just add to that, because yeah, I agree with you. But the point is, government policies should actually, create, should force those companies to make a little bit of investment into R&D in the country, especially into health. If you're a government and you're making trillions, at least telling a company to put a bit of it into R&D in the country is not a crime. And I'm sure those companies will not reject it. It happens everywhere in the world. I mean, you could do that by maybe asking them to put a fraction and then give them a tax break or whatever. But the policies, government policies, are very important in order to get those companies actually do the investment. And I think everything goes back again to government. Our government looking at it in the way you're looking at it. And I think we need to communicate and let them know that there is really low-hanging fruits around where they can actually talk to companies to reinvest a bit of their profit in supporting, local R&D, especially for health on the continent.
Okay, thank you, James. Thank you. Thank you, Prof. Happy. Robert,
Can I suggest that Paulette asks her question on packaging the information for policymakers, and then we can go to Robert, who then I saw has his hand raised. So Paulette, then Robert, ask both questions, one after the other, and then we go on from there.
Thanks, Ethel. I think my question, and also has been just alluded to the speaker, the comment made a few minutes ago, is that as researchers are able to package the information for it to be able to be easily absorbed by either the private sector who we are targeting or the government, for them to be able to buy into what we are doing, and in return be able to understand and see the benefit of investing in the same. And the second one was on the budget process, like where are we as researchers and research organization when the budget is being made? How involved are we in these processes to be able to make sure that our issues are articulated and what we hope for and what we desire in terms of the work that we do and the benefit is taken care of throughout the process.
Okay, so thank you, Paulette. A lot of what you have asked was well tackled by Dr. Parfait. I think it's the whole level of engagement. He talked about how they engage researchers from the beginning in Rwanda, how even when it comes to grants, that grant proposal is made more robust when government is involved. And then there is no research invested in the people of Rwanda that should remain on the shelves. So a lot to do with knowledge translation. So well done by Dr. Parfait. And I think that's one of the key things that we need to pick.
Robert.
Yeah.
Yes. Thank you again. And mine is really just a comment. I've been very excited listening to all the panelists, and I could not have hoped for a better conversation. And thank you, Dr. Wamishwe, for an amazing job facilitating. One of the things that I think has really struck a note with me is the conversation, especially from Dr. Happy, about what's our private sector. How do we do R&D in the private sector? How do we do innovation in the private sector? And the issue of how do we frame incentives for private sector investment. And I think it's one of the things that we need to reimagine R&D, not just happening within academia, but also happening within the private sector in a much more engaging way. Last year alone, we saw about $5 billion of venture capital investment in startups across Africa. Nigeria took more than probably 1.5 billion of that, a lot, by far the leading country. And one of the things I've been seeing is, we're celebrating is the promulgation of the Startup Act that really starts to talk about how do we build an ecosystem for startups that can enable innovation to thrive. But what I've been asking myself is, even as we see this, are we sure that we as scientists, as people who are in academia, are part of this? Are we looking at innovation ecosystems being built that are just envisioned purely for digital innovations, the fintechs, the buy now, pay later kind of business models, but not speaking to the life and death issues of where our drugs, where our vaccines, where our medical devices, where our diagnostics, and how do we ensure that we don't just do innovation for digital, but we also have a life sciences vector innovation systems thinking that's driving this conversation, because what works for fintech does not really cross over to life sciences. Our CapEx, the level of regulatory, it's a completely different landscape. And I think it does require a lot of dedicated thinking to be able to do so. So my question would be, Dr. Happy, what's happening in Nigeria in regards to life sciences? Dr. Parfait, how are you supporting life sciences innovation specifically? And also for other parts of Africa, I'm really keen to hear, how do we get this conversation of a life sciences innovation system happening?
Okay, so that, yeah, so over to you, Dr. Happy. Yeah.
Yeah, I do think that you will see a lot of investment in fintech because that is quick gain and that is normal. But at least invest in life sciences and in matters of life and death, it takes time to actually generate profit. That's why you're seeing venture capitalists actually putting in a lot of the money there. Then the question, even if you see venture capitalists and then having all this investment, the question is how much are those fundings coming from within Africa? So, and I mean, these are very germane questions. So we have African philanthropists, we have African, people in the private sectors, and are they really investing, in those sectors? The answer is no. I think, even if you wanted to do that, the question is how much of it goes into the areas that matter with in issues of life and death. As you know, Robert, we've invested a lot, our knowledge, and then translating knowledge into areas of diagnostics and then vaccines. So the question is, who takes it forward? So are people really ready to invest money to take it to a level whereby we could say, okay, here we want to put it down to put it out there in the market? So and are we going to be sitting back and waiting for people to bring money from outside to do it? The answer is no, because they're already funding quite a number of initiatives outside Africa to produce the same kind of tools or the same kind of tools that we are developing. So there's a need to to create something from within that will encourage the private sector to make this investment, because it's not just government alone. Let the government set the framework, and then create the incentive that is necessary for the private sector to invest so that we can take this forward. That's all is needed at this point, and then you will see the investment. If there's no framework, if there's no incentive, it's going to be very difficult for people to just really invest into this space. Over.
Okay, thank you. Dr. Parfait, anything you want to say, or maybe you can put it as a closing remark? So it's 9 minutes to our ending this session. So I will give each of the speakers a minute to do closing remarks, and then we summarize and then call it a day. So Dr.
Maybe we
Parfait,
can start with Dr. Ogwell. He is back.
Ogwell is back. Okay.
Yes.
So Dr. Ogwell, I hope he got the summary of the interesting conversations that were happening here. Maybe I can do the summary, then you now all do the closing remarks so that Dr. Ogwell gets what was happening while he had just stepped out. So today we had 4 interesting speakers. Of course, we had Dr. Ogwell, that is the Acting Director, Africa CDC. We had Dr. Parfait from the Ministry of Health, Rwanda, Professor Setswe from the Arum Institute in South Africa, and Professor Happy, a professor of molecular biology and genomics from Nigeria. And in Kenya, we like to say, while you were away. So Dr. Ogwell, while you were away, there was very interesting conversations. We took up from where you left us, and we decided that as Africa, we are going to stop saying that COVID, we learned lessons, but rather, what have we changed given the lessons that we learned? That's the first thing that we got. The second thing is we seem to be having imposter syndrome as Africa. We do a lot, we have a lot of capacity, but at some point we don't believe in ourselves. Professor Happy really brought that out, that a lot of innovation has been done in Africa, but we don't get to see it to the end. We do not own patents for a lot of the intellectual work that we have done. And Africa has the unique opportunity to do this. And the first thing is we need to have leaders who believe in the capacity of its people. The other thing we talked about is we are not going to, when it comes to manufacturing, having a lot of biovaccines in each country is not the way to go, is not sustainable. Perhaps look at hubs of excellence. But for this to be done, we need to remove, our leaders need to stop thinking as silos. Our leadership needs to change. We need to have a lot of brain and knowledge circulation within Africa for us to gain as regards research and development. Then Professor Setswe asked, where are the Bill and Melinda Gates of Africa? Where are the billionaires? Why are they not investing in R&D? And why isn't the private sector really not getting itself into the party the way we expect? And then lastly, Dr. Parfait was able to demonstrate how Rwanda as a country has been able to engage with its researchers. The researchers are engaged right from the start, including even what research is carried out. That discussion is had with government. They have the National Health Research Committee, which is the first place that you stop before even you begin to take your proposal for ethical clearance. I think that was something that we learned. And they're able to measure because they're able to get a lot of information in their database, including who is funding this research. So they're able to do documentation that government has regarding who is funding research in Rwanda. So it is possible to measure. And I think that is one of the things, even as Kenya, we have taken. So over to you, Dr. Ogwell. Perhaps now you would be able to make your closing remarks. Thank you.
No, thank you, Joyce, and thanks to this very eminent panel of experts, African experts, I may add. These are, with this summary, I think the only thing that I would add is the action that we need to take when we are saying that we should not say we have learned, that we have changed. That change that we need to make, we should have done it yesterday. Today is not too late, but we should not wait until tomorrow. So that action needs to be now. And we as Africa CDC, we have committed that we are stopping to complain. We are going to do. If people are complaining that we are doing too much, it is okay, but at least let's do. Let someone complain because we did, not someone complaining because we did not do. So whatever it is that we need to do to make that change, let's do it now and let's not wait for tomorrow. And you can count on Africa CDC's participation fully in the doing today and not waiting for tomorrow. Thank you very much.
Thank you, Dr. Ogwell, for that. Dr. Parfait, your closing remarks.
Thank you very much for this interesting discussion. I will say, I won't be again repeating what I've said. One thing that I want to emphasize is we need research, and research that's responding to the needs or our priorities. So research should be, questions should be aligned to the priority of the countries, but we need also to ensure that as a government, you provide conducive environment to conduct research. We shall continue to provide policy guidance to the researcher, but also supporting them throughout that journey in terms of capacity, in terms of access to funding, but also in terms of knowledge management, making more useful the evidence that has been generated through the research. So another thing that I'll mention, going forward, we need to work together, not only for the sake of thinking big from small implementation research to the productive research, to ensure that we can also manufacture supplies or medical products that's quite with a high cost in terms of to the health system when it comes to the access to the services. So that's the key point I'll mention when I close my remarks. Thanks so much. Again, thank you for the organizer and all the panelists. Thank you so much.
Okay, thank you, Professor Setwe.
Thank you for this opportunity. In my closing remarks, for us to take health research and development forward in Africa, we must have all stakeholders on board. We have heard today that there is a role for government and public sector universities, particularly the medical schools. We also have heard that there is a role for the private sector. They can do more in this continent. But there are two other stakeholders that we should add onto the list. The advocacy groups. I work with the SATAC, South Africa Health Technology Advocacy Coalition, which is a network of non-governmental organizations seeking to catalyze action on health research and development. And if we're able to get more of those advocacy agents, we are able to ensure that the governments are becoming accountable, the public universities are becoming accountable, the private sector is also involved. The last group that I want to add, the stakeholders, is the advocacy groups, the NGOs. I work for the Oram Institute. It's an African organization advancing health science and innovation. We were involved in COVID-19 vaccine trials. We were the first to get involved in the Sisonke trial, testing the J&J vaccine among healthcare professionals. We're involved in TB vaccine trials and TB preventive therapy. We develop HIV diagnostics with the private sector, and they provide evidence to government about HIV and TB prevention interventions that are effective. So we need to bring all stakeholders on board: the government, public universities, the private sector, the NGOs, and advocacy groups, to ensure that we make a big impact on health R&D in our continent. Thank you.
Thank you very much, Professor Happy.
Yeah, thank you. I just want to say that R&D is at the core of Africa's future. And Africa has to believe in itself, and Africa has to take its future in its hand. The future of this continent and is very tight to its, what I call, health security. So, and as such, everybody, all actors, both public, private, advocacy group, and as everybody mentioned, should be hands on deck, and then we should believe in ourselves. The Africa freedom and Africa progress will not come from outside. It has to come from within. And without us being intentional about it, nobody's going to do it for us. We'll be left behind. And we need to change that today, not tomorrow. Thank you.
Wow, fantastic, fantastic way of ending this session. We must do it today. We should have done it yesterday. If we haven't, we do it today, because tomorrow is too late, and we must believe in ourselves. So this is the end of, we've come to the end of this session, of end-to-end visibility, funding research for impact. Thank you very much to our eloquent speakers. Thank you to the participants, you've been great. And thank you to IAVI for considering it, that we should start with such a powerful session as this. Over to you, Ethel. Asanteni, meaning thank you in Kiswahili.
Thank you so much, Dr. Mishra. There is really nothing more for me to add on this conversation. Lots of food for thought, definitely food for action. So I hope we will all be taking action going forward. Just to let you know that a recording of this meeting will be available from end of next week, so that we can really listen to our action points, to the things that have inspired us today. And also to mention, tomorrow there's another conversation on the impact of debt, on the debt burden, on domestic resource mobilization. So please join us again tomorrow for a very exciting and what we hope will be an impactful and motivational conversation. Thank you so much. Thank you for giving us your time. Thank you for participating, and bye-bye.